Welcome to my channel. Let's talk about health in Africa. In this podcast, I talk to leaders and change makers about how we should improve healthcare in Africa. Leaders such as President Ameenah Gurib Fakim of Mauritius, Dr. Faisal Shuaib of Nigeria, and Professor Abdool Karim from South Africa. Even though we've talked about these issues for a long time and we know what they are, very little progress have been made in many areas of healthcare for the majority of African people. So how do we move from aspiration to action, ensuring that sufficient investment is made in protecting the health security of African people in a way that is inclusive and leads to economic prosperity for individuals and for nations? In these conversations, we put the challenges into perspectives by talking about how they impact lives and hold back sustainable development of nations. We explore the solutions that are being put into action to change the state of healthcare in Africa and ask whether what's being done is what needs to be done. And what other actions must be taken to close the gap between what is being done and what needs to be done? Why is it, for instance, that the survival of a disease that is preventable and treatable, like cervical cancer, is so poor amongst African women? And why do young women and girls continue to be the majority of those who are newly infected by HIV when we are investing billions of dollars into the HIV pandemic response? What I love about these conversations is that they prompt leaders to dig deep into their experiences and explore real actions that will transform the trajectory of healthcare and, by consequence, African economies. They are conversations that are desperately needed but have not been happening. My hope is that these conversations will help us to dig deep into the way we think about healthcare in Africa and take another look at the things that we have come to take for granted and ask whether they have been driving or limiting our progress. Most importantly, I hope that these conversations can prompt real actionable solutions that will change the status quo and improve the well-being of African people and secure African economies. So please join me on Let's Talk About Health in Africa.